Hey everyone, today we're going to tackle a topic that, let's be honest, affects so many of us: foot and ankle pain. We're going to break down some of the most common reasons why you might be hurting and, more importantly, map out a clear path to getting better. So let's take that first step together and really understand what's going on down there. And I want you to really think about this for a second. Is that nagging pain in your heel or that stiffness in your ankle just a minor annoyance, or is it actually stopping you from doing things you love? Like taking a long walk, playing with your kids, or even just getting through the day without wincing. It's a feeling a lot of people know way too well. And here's the thing that's so crucial to understand. These aren't just foot problems. Your feet are literally the foundation for your entire body. So when something's off with them, it can create a ripple effect, throwing your posture and balance out of whack. That can lead to pain in your knees, your hips, and even your back. It is all connected. So if we're going to find the right fix, we've got to play detective first. We need to decode what's actually causing that discomfort. Let's dive into some of the usual suspects. Okay, first up, let's talk about flat foot. This is basically when the arch on the inside of your foot collapses. And without that arch doing its job as a natural shock absorber, your feet can get tired and achy really fast. It's a huge reason why people complain about that deep fatigue after a long day. Next up, the dreaded bunion. The official medical term is hallux valgus, and you'll know it if you see it. It's that bony bump that forms at the base of the big toe. And trust me, it's not just about how it looks. It can be super painful and makes finding a comfortable pair of shoes a real nightmare. And then we have something different: club foot. This is the condition that's actually present from birth, where one or both feet are twisted out of position. Now, the key thing to know here, and it's really good news, is that with early and proper medical treatment, the outlook for kids is incredibly positive for developing full mobility. So how do you know when it's time to stop trying to fix it yourself and actually see an expert? Well, here are some major red flags. If your pain gets worse when you're active, that's a big one. Or if you can actually see changes in the shape of your toes or your arch. And here's a huge tell: if you've tried supportive insoles and they just aren't cutting it anymore. These are all signs from your body saying, hey, I need some professional help. Okay, so you've got a better idea of what the problem might be. So what happens next? Look, deciding to get help can feel like a huge step. But the really reassuring part is that the treatment process isn't a mystery. It's a clear, well-defined journey that's all about getting you back to feeling good. And this journey usually follows 4 main stages. It all starts with a super precise diagnosis, using things like x-rays to get a perfect picture of what's going on. Then comes the correction. And this is so important. The procedures are tailored specifically for you. These days, doctors use amazing, minimally invasive techniques, which means a much faster recovery for you. And finally, it all wraps up with rehabilitation. Because fixing the structure is one thing, but getting your strength and stability back, that's what makes it last. Now we get to the million-dollar question, right? The one that's probably on your mind. As soon as you hear orthopedics, your brain might jump straight to surgery. But is that always the answer? Well, not necessarily. Let's break down how that decision is actually made. You can really see the 2 different toolkits here. On one side, for milder issues, you've got conservative care. Think supportive shoes, custom insoles, physiotherapy. It's all about managing the symptoms and keeping you comfortable. But on the other side, for those more severe, painful cases, that's where surgical correction comes in. The goal there isn't just to manage, it's to fix the root cause and give you lasting relief. It all comes down to what's right for your specific situation. All right, so we've figured out the pain, we've looked at the treatment journey, but what's the payoff? What's the whole point of all this? Let's talk about the final outcome, the end goal. This quote right here just nails it. The real goal isn't just being pain-free. It's about getting your confidence back. It's about being able to move through your life without that hesitation, without that fear of the next painful step. It's truly about getting back to being you. So, what kind of timeline are we talking about for this transformation? Well, for a lot of corrective procedures, the main recovery window is right around 6 to 12 weeks. That's a real, manageable timeline. It's a short-term investment of healing and rehab that paves the way for a long-term, pain-free future. And let's be absolutely crystal clear on this. The goal is not to just get you a little better. The goal for the vast majority of patients is a full 100% return to normal walking. And proper rehab? That's the secret sauce. It's the key that unlocks that outcome, making sure you don't just heal, you heal strong. So, we'll leave you with this question. If pain has been dictating your life, holding you back one step at a time, just know that there is a path forward, and it all begins with one simple decision. So, are you ready to take it?